Human Rights Watch has revealed a shocking report on the treatment of mental health patients. It found that men, women and children are often chained or locked up in confined spaces as their families struggle to cope. This body believes this is due to government's failure to provide adequate mental health services. Let's discuss this with Kriti Sharma from Human Rights Watch. A very good morning to you. Kriti, tell us more about these very disturbing findings.
Our new report has found that hundreds of thousands of people are spending weeks, months, and sometimes years tied to a tree, locked in a cage or a shed, simply because they have a mental health condition. Families struggle to cope, and currently governments are failing to provide adequate mental health services in communities.
But why do they choose that route? I mean, what's behind that?
It's a widespread practice that's happening across 60 countries. And what we find is that because there's such prevalent stigma, there's lack of awareness on mental health, people believe that a mental health condition is the result of being bewitched or being possessed by evil spirits. And as a result, the first port of call is a traditional or a faith healer. When that doesn't work, they don't know what else to do. They are worried the person might run away, might get lost. And as a result, they turn to chaining. It's a practice that's happening across cultures, across religions, in Asia, Africa, the Middle East, Europe, and Latin America.
I mean, if they treat it that way, I mean, obviously they'll never get the help that these people desperately need. And clearly there's a fear factor. I mean, they elicit some sort of, they make people frightened.
There is fear because there is lack of awareness. In a number of communities, although the practice is an open secret, there's very little information available from the government on what mental health is and forms of support to really make sure that families can, help their relatives. So that is the real problem here, and that's why we're calling on governments to combat stigma, working with people with lived experience. Secondly, to ban shackling and monitor institutions where this practice occurs. And thirdly, to urgently provide community-based support, not just restricted to mental health care, but also access to housing, education, and employment that people with mental health conditions need to thrive in their communities.
Why are governments so reluctant to get involved here?
It's I would say it's an invisible problem. It's happening in rural areas. It's not always on the government radar. Mental health is also very neglected. Although 1 in 10 people around the world have a mental health condition, governments only spend 2% of their health budget on mental health. And it's time that changes.
Okay, so I mean, that's all right. We're going to chase that up, actually, with government to find out why this has not been taken seriously when so many people are affected. And I should imagine that this problem has got worse under the pandemic.
Absolutely. One of the men I met, his name is Sodekin. He had been locked in a shed for 8 years. After getting government support, he was released. For 4 years, he was free. He was working in a local clothing factory. He did the call to prayer at his mosque, and he was thriving when the pandemic hit. And his family lost access to mental health care, and they shackled him again. So for the last many months, he's back in chains. And that's really the tragedy of this issue, is that people go in and out of chains depending on the support that's available. And COVID-19 has hit really hard.
Kriti Sharma, very important issue that you've raised there with us. Thank you for talking to us.